when we give the medicine to the patient, medicine produce accessory symptoms. And these symptoms are not because of these emotions, their change in the physical temperament of the patient. But when these symptoms produce, because they are always only symptom of nature, as this disease was itself capable of producing in the organism. These symptoms are suppressed by external applications of the medicines, antipathic medicines, isopathic medicines, external use of medicines. When these symptoms suppressed only and the body only show some prominent symptoms, and when you give the medicine, these symptoms are coming out as these symptoms produced by medicine. But note, because these disease also produce this kind of symptom in the patients, and which are summoned forth, or we can say that to call into existence. These are already there, but not in dominant state, and induced to make their appearance by the medicine given. You give the medicine, these symptoms which are hindered behind that three prominent symptoms now prominent. Now it's showing in the body, and the symptoms feel by the patient. You got my point? And going to its power to cause similar symptoms. So in other words, we have to regard the whole collections of the symptoms. Now we have to take every case, every symptoms now acceptable. Now the patient can feel these symptoms. Now the patient can say these symptoms. All sensation come back. All sensation, all suppressed symptoms come out as belonging to the disease itself, because these symptoms are belong to disease as the actual existing conditions, and to direct our further treatment accordingly. Now, your medicine, after your medicine, these symptoms are prominent, and this time we have to feel that all these symptoms belongs to disease. Then, in aphorism number 182, thus the imperfect selection of the medicament. The selected medicine was imperfect. The selected medicine was partially selected, which was in the case almost inevitable. Certainly happened. This condition is unavoidable, because whenever you have few symptoms, you always select partially selected medicine, owing to the too limited number of symptoms present, because there are only few symptoms, only few number of symptoms are there. Serve to complete the display of the symptoms of the disease, and in this way facilitate, make easier the discovery of the second, more accurately suitable and homeopathic medicine. Because once you have a case, the person having few symptoms, after giving the medicine, the symptoms, the suppressed symptoms come out, and now the situation is that the person having a many symptoms, the suppressed symptoms come out, and this is the time when we take the whole case, and we are ready for second prescriptions. But most important part is starting now, because here If you give the medicine to the patient, you destroy the whole case. Person having prominent symptoms, they are coming out. But if you immediately give medicine, you destroy the whole case. So we have to wait. How much we have to wait? Then Dr. Hahnemann described in 183. Whenever, therefore, the dose of the first medicine cease to have a beneficial effect. This should remember every single person. You'd give them medicine. Patient says, doctor, what medicine you give? My symptoms are now coming out. I have many symptoms now. I have this problem, that problem, this problem, that problem. And you have to give a non-medicinal substances here. Don't change the remedy, don't give any other remedy until and unless it demand speedy aid. Dr. Hahnemann says, if the newly developed symptoms do not, by reason of their gravity, demand more speedy aid, if these symptoms are very prominent and you need immediate assistance, only and only that situation we can change the medicine. Otherwise, you have to wait until the first dose of medicine cease have a beneficial effect. Take the case, no problem. Take the whole symptoms, but wait for a while. Which, however, from the minuteness of the dose of homeopathic medicine and in very chronic diseases and excessively rare, because we give very minute dose and very rare chances patient having a emergency symptoms, emergency condition happen. And until and unless, and how we can judge that, how much time we need to wait, then you have a boric materia medica, then back of that materia medica, there is one chart where they give a action of the remedies, how much time any person need time to wait, any how much we have to wait in these cases. Like acetic acid, we have to wait 2 weeks. Then acid fluor, we have to wait 30 days. Acid force, 40 days. Aconite, we can repeat immediately. Ethusa, we need 20 to 30 days for wait. Agnus, 8 to 14 days. 1 week to 2 weeks. There are duration, how much time we need, and other thing, patient give you a data. That person, doctor, before the symptoms, when you give medicine, there are lots of symptoms. Now this week I have not that much symptoms. I have not that I'm good. Until and that person is progressive, until and unless patient getting relief, then we have to wait for a while. Every week we will examine the case, and if we think the person does not need any other remedy, don't give. So a new examination of disease must be instituted and status more by the state of the disease as it now is must be noted down. According to Hahnemann, along with it, we have to take the case again and again and again. So until we have to note it down the symptoms and which symptom is eradicating, just crossing it. And second, homeopathic remedy selected in accordance with it, which shall exactly suited the present state, and one which shall be all the more appropriate and then be found as the group of symptoms become more larger and more complete. As the symptoms increase and the patient giving us a exact complete symptoms, then we have to select the medicine according to that. So in 83, this is in fourth edition. Oh, sorry, this is from the sixth edition. This is from the sixth edition. So if we see in footnote of aphorism number 183, in case where the patient, which however happen excessively seldom in chronic, very rarely in chronic, and not infrequently in acute cases, it happens in acute cases, feel very ill, where the patient, in case where the patient is feel very ill, and this is very rare in chronic cases and most frequently we can see in acute cases, the when patient feel very ill, although his symptoms are very indistinct, not clear, sharply defined, so that this state may be attributed more to the benumbed state, a condition where someone has low sensation, whether physical or emotional. Feeling ill, very ill, but the person giving you unclear symptoms. These symptoms, when these symptoms are unclear, this is because of the benumbed state. When person sensations are lost, it may be a physically, it may be a emotionally. And I give you one example. One last week, one person, doctor, I take lots of medicines. I took allopathic, Ayurveda, antibiotics, steroids, this medicine, that medicine. But even though I take allopathic, homeopathic medicines too, but nothing is helping me. Nothing is helping me. Nobody give me relief. Even a strong painkiller is not giving relief. This is a benumbed state. Benumbed state of the nerve. Patient does not permit the patient's, which does not permit the patient's pain. The patient does not feel any pain. Painlessness and suffering to be distinctly perceived. The torpor of the internal sensibility is removed by opium. This is the state of opium. When the person doesn't feel pain, when the person's reaction is low, when the given medicine does not show any effect, well selected remedy when showing no effects. This is the benumbed state of the patient, and this is cured by opium. And in its secondary action, the symptom of the disease become distinctly apparent. Secondary symptoms, when these symptoms showing more prominently. The patient feel more sensations. Then in aphorism number 184. In like manner, after new dose of medicine has exhausted its actions. In sixth edition, Dr. Hahnemann uh, adds something, a condition where someone has low sensation, whether physical or emotional. No, this is not. But in sixth edition, Dr. Hahnemann says when it is no longer suitable and helpful. In fifth edition, Dr. Hahnemann says after each new dose of medicine has exhausted its action, only and only give second potency when the first potency exhausted. And in sixth edition, when it is no longer suitable and helpful. When the first dose or medicine is no longer suitable or helpful, the state of disease that still remain is to be noted anew. The symptoms, the conditions, the signs which are still remain in the patient, we have to find out these are a new condition. Just take it a whole case again with the respect to its remaining symptoms and another homeopathic remedy sought for as suitable as possible for the new group of symptoms now observe, and so on until the recovery is complete. So we have to go through, if one symptoms remain, we have to take it anew, and this is how we can select the medicines. So these are one-sided diseases. Now we are entering into the external diseases. When the person having a external diseases, what precaution we have to take in these cases? So among the one-sided diseases, an important place is occupied the among the one-sided disease, as important place is occupied by so-called local maladies, by which term as signified those changes and ailments which appear on the external part of the body. So this is type of one-sided disease when these are appear on external part of the body. Till now, the idea prevalent in school was that these parts were alone morbidly affected. The old schools till today is always says that these are the local element and the only part is disturbed, only part is affected. And the rest of the body did not participate in the disease. A theoretical absurd doctrine which had led to the most disastrous medical treatment. So this is not a case. External diseases. In fifth edition's aphorism number 186, one of the most important aphorism in every homeopath here. Every single homeopath remember this aphorism. So those so-called local maladies. Sometimes we have such a cases and we are trying to prescribe the medicine, but failed. These so-called local melodies, which have been produced a short time previously, short time previously, it means these are acute. These are acute. Solely by external lesions. Having an external lesion still appear at first sight to deserve the name of local disease, and we feel that these are local disease. These are local disease, but then lesion must be very trivial, of very little value or importance, and in that case, it would be of no great moment. For in the case of injuries, so Dr. Hahnemann in these aphorisms wants to say that, for example, one person who comes to you and having a external wound, bruise, any bruise sometimes, and it happened before, and you feel that this is a one-sided local disease, the person having injury, and after injury there is a bleeding for it. This is type of local disease, but what precaution we have to take in these cases? For in the case of injury occurring in the body from without, if they be at all severe, the whole living organism sympathize. They occur fever, etc. The treatment of such diseases is relegated or with less value in homeopathy. Also to surgery. But this is the right only in so far the affected part require medical aid, and where the external obstacle to the cure, which can only be expected to take place by the agency of the vital force, may be removed by mechanical means. For example, some person having a reductions of dislocation, person having dislocation, person having a broken bone, person having a tear, person having a tear of the skin because of the accident, person having a loss of blood in the accident. In these cases, you cannot do anything. So this is the time where we need help of surgeons. So, but this is the right only so far as the affected part require mechanical aid, where the external obstacle to the cure, which can only be expected to take place by the agency of the vital force and may be removed by mechanical means. Mechanical means by the reductions of the dislocation, by bandages or being together the lips of the wound, by extractions of the foreign body that have penetrate into the living part, by making a opening into the cavity of the body in order to remove an irritating substance or to procure the evacuations of the fusions or collections of the fluid, by bringing into positions the broken extremities of a fractured bone and retaining them in exact contact by the appropriate bandage, etc. So this is the circumstances where we cannot do anything. This is the work of surgeons. They help us this because these are external obstacles to cure. We are not able to cure without external help. But when in such injury, the whole living organism require, as it always does, active dynamic aid to put it in a position to accomplish the work of the work of healing. For example, after surgery done, the bone fracture, they make straight the bone. If the bone is dislocation, they cure it, put into the right position. If there is a torn skin, uh, they make it clear. But after surgery, if the patient having a violent fever from extensive contusion, lacerated muscles, tendons, blood vessel required to remove by medicine given internally, or when the external pain is scalded or burned part need to be homeopathically subdued, then the service of dynamic physician and his helpful homeopathy comes to request requisitions. So in this situation, we can only give medicine if these after these external obstacles, if these external problems, after curing it after surgery, if the patient had any complaint like fever, like pain, like anything, like nausea, like not able to digest anything, in this situation we can use homeopathy. Otherwise we have to avoid and get help from other field. In 187, but those affections, alternations, and ailment appear on the external part. Now the this is not a accidental injuries situations. So in this situation, when alterations or ailment appear on external part, like eruptions, that do not arise from any external injury, or that have only some slight external wound, for their immediate exciting cause are produced in quite to another manner. They are not because of injury, they are not because of chemical irritations, they are not because of any accident, but these are the complaints which are internally produced, vital force produced on external part to save internal problem. Their source lies in some internal malady. Their source lies in internal malady. So consider them as mere local affections, and at the same time to treat them only or almost only as it were surgically, with topical applications, as the old school have done from the remote age, is a absurd as it pernicious in its results. But because the old system, what they are doing, they given them external application and try to remove. And this Dr. Hahnemann says this is harmful effects and gradually subaway. They are gradually subaway, but having harmful results. But next, Dr. Hahnemann says these affections were considered to be merely topical and were therefore called local diseases, as if they were maladies exclusively limited to those parts wherein the organism look little or no part. And they said nothing is inside, but this is only a pimple, this is only a small eczema, this is only a small eruptions, but this is not like this. Or affections of these particular visible part of which the rest of the living organism, so to speak, know nothing. So one of many great and pernicious blunder of the old school. This is not the case. But in aphorism number 189, and yet very little reflection were sufficient to convince us that no external malady, not occasioned by some important injury from without, the eruptions, the malady which is not from the injuries, can rise, persist, or even grow worse without some internal cause. Nothing happened without internal causes, without the cooperation of the whole organism, which must consequently be a disease state. Because first, internally, everything will come first, and after that, the external eruptions, external lesion appear until the whole organism is involved. It could only make its appearance at all without the consent of the whole of the rest of the health, and without the participation of the rest of the living whole of the vital force that provide all the other sensitive and irritable part of the organ. Indeed, it is impossible to convince its production without the instrumentality of the whole life. So intimately are all part of the organism connected together to form an invisible whole in sensation and functions. No eruptions on the lip, no vitiligo can occur without previous or simultaneous internal ill health. So slowly, because sometimes small things, when suppressed by any mean, slowly, it become a internal disease, and it comes out on external level. For example, a few days before, I take one case of uh, alopecia areata. Yesterday, I talked with that person. So the whole head having a small pieces, and the doctor gave him injection in the head. I post that injection name. This is a triamcinolone acetonides, and this they are giving by the dermatologist under the skin of head. And when I see the side effects of it, the side effect is skin atrophy, thin, thinning, and hypopigmentations, lightening of the skin, and the telangiectasia, the small vessels you will see in that particular part. These are the side effects. And one condition is morphia. A few days before, I put this pictures of this morphia on
Mm.
uh, on my Instagram. Small. This is an autoimmune disease. Alopecia areata is a autoimmune disease when body kill their own hairs. They put injections directly under the skin. And he said you have to take 6 sessions. It means every time he give injections to the skin. What they are doing, they are suppressing the system. Once they suppress the system, slowly, the skin become tight and it converted into morphia. Converted into morphia. So slowly, we are because of lack of informations or the dominancy of the other schools, especially in the Western countries, dominancy. They are not allow anyone to treat the patients. So the patient having a complex diseases, small diseases and the other diseases when meet together and they become complex diseases. So in 190, all the true medical treatment of diseases on the external part of the body that has occurred from little or no injury from without must therefore be directed against the whole which affect the inhalations and the cure of the general malady by mean of internal remedies. And if it is wished that treatment should be judicious, sure, efficacious, and radical. So we have to give internal remedy in this case. If you give external remedies, you will suppress the condition and the patient will get more serious conditions. So in 191, this is confirmed in the most unambiguous manner by experience, which show in all cases that every powerful internal medicine immediately after its ingestions cause important changes in the general health of such a patient and particularly in the affected external part, which the ordinary medical school regarded as a quite isolated, which show in all cases every external disease, every person who suffers from external eruptions, every person who has a disease on the upper level, every powerful internal medicine, when we are giving medicines to them after it ingestions cause important change in the general health. So, first of all, the patient will see changes in general health. If we say immediately your external eruptions gone, it is not possible. First, changes inside of the patient and particularly in the affected part. Even in so-called local diseases of the most external part of the body, and the change it produces is almost solitary, being the restoration of the health of the entire body, along with the disappearance of the external affections. So first, changes in the inside, and these changes when internally the state of the patient is changes, and after that there is a disappearance of the external affections without the aid of any external remedy. So we are to avoid any external remedy whenever we are dealing with any type of external problem. Provide the internal remedy directed towards the whole state was suitable chosen to the homeopathic sense. Whenever we are selecting medicine according to the homeopathic law, we give internally, avoid to give external any type of applications to the patient. In 192, this is the best affected when in the investigation of the case of disease. When we are investigating the disease, along with the exact character of local affection. First of all, whenever you have a patient of a local disease, okay, it may be a one-sided or it may be different places. Like in psoriasis, you have lots of patches, mostly into the head, sometimes on the arm, sometimes on the back, sometimes on the body, sometimes on the legs. Along with the exact character. So these exact character you can only judge when you have a knowledge of practice of medicine. When you have a knowledge of practice of medicine, we can only identify these external disease, external skin lesions. So exact character of local affections, all the changes, what kind of changes there are. There are a scab, there is a mucus coming out, is there is a pus coming out. What are the character of pus? Is it a yellow? It is a green? Is it a mix of blood and orange color? It is a black? It is bloody? And what type of eruptions are coming? Changes are coming. Suffering and symptom observable in the patient's health. Doctor, I have a pain. I have eruptions here. And the person says, I feel the pain here in this place. Eruptions is here, but the person feel the pain here. Can anyone tell me the remedy? Person having eruptions in the thigh area. Person having a eruptions in thigh area, but he feel the pain in the toes. Toes. Remember always one wonderful remedy. This is Kali iodatum. When the pain, the person feel pain far away from the main complaint, far away from the exact site. Kali iodatum is the remedy when pain is away from the exact site. So observe the patient health, which may be previously noticed that when no medicine has been used, which may have been previously noted when no medicine has been used and taken in conjunctions to form a complete picture of the disease. But nowadays, most of the cases, patient already taken so many remedies and come to you, then you have to remember aphorism number. Which aphorism number you should remember? Anyone? If the person already taking allopathic remedies, steroids, he took lots of antibodies, lots of everything, painkillers, so much thing, and comes to you and having external eruptions, which aphorism you should remember in this case? Anyone?
73, sir.
Huh?
173.
No. Anyone? And if the person comes to you and say, doctor, I have took lots of homeopathic medicines, so many medicine, then which aphorisms you should remember in this case? Person having a local disease, one person already taken so many allopathic remedies, and one person so many homeopathic remedies? Anyone? I told you guys many times, many times. First, if the person if the person already taken so many allopathic medicine, remember aphorism number 207. Always remember, when the person taken so many allopathic remedies and comes to you having local affections, remember 207. But if the patient already taken so many homeopathic remedy, then that you have to remember aphorism number 94. No, 91, sorry. 91. When person taking so many homeopathic medicine, 91. And when the person taking so many allopathic remedy, aphorism number 207. 207. So those peculiar pathogenetic effects are known, and for a remedy corresponding to the totality of symptoms, so that selections must be truly homeopathic. So we should know peculiar pathogenetic effects of known medicines. So if you want to know the pathogenic effects of drug, which book we have to read? This is the book you should read for the pathogenetic effect. This is a manual of pharmacodynamics, biochemics, and physiological effects of drugs and their mechanism of action, Dr. Richard Hort. Every person should read this book, especially when you are dealing with external application, external diseases.
Is it possible for you to share with us a picture of the book,
Sure,
please?
I will send. I will definitely send.
Thank you. Thank you very much.
So, how and physiological materia medica of birth, second book. I will show you. Second book is this. A physiological materia medica of birth. If you want to know about how the medicine pathogenic effects are peculiar pathogenic effects. Which medicine, how these medicine, what kind of eruptions produced by these medicines. So we can select a truly homeopathic remedy. And in 93, by mean of this medicine, employed only internally, only internally, not externally. And the disease be but of a recent origin, often by a very first dose of it, should give internal remedy. The general morbid state of the body is removed along with the local affection. Your medicine first internally cure, and when the affection is internally inhalated, externally it automatically inhalated. And the latter is cured by the same times as former. When internally person is cured, externally is immediately cured. Proving that the local affection depends solely on the disease of the rest of the body and should only be regarded as an inseparable part of the whole, as one of the most considerable and striking symptom of the whole disease, because that external disease is the striking symptom of internal problem. If you try only external, you will not able to cure that case, because this is the striking symptom of the whole disease, which is shown on external part. This is not a mere local disease. This is not a mere isolated disease. This is the most considerable and striking symptoms of the whole disease, which is shown on the external part. So this is a basic informations of external diseases, and the next part is how these we can uh, go more deeper and deeper to identify the and how we can treat these cases with homeopathy, and the next session we will discuss about it. So now if you guys have any question, please open your cameras, everyone. So any questions you guys have, any difficulty, anything you feel that it's is not understandable, then we can go through it. It may be slightly boring because we are reading Organon, but it is very important for us because we need to understand it to give a cure to the external, because external diseases are not easy to handle with it. So we need two type of thing. First practice of medicine, so we can judge the exact nature of the external disease. What is it? And second, organon of medicine, how and what are the manual how we can deal with these cases. And third is materia medica, what we need to use, which medicine we have to use to cure these diseases. These are the three main part of our conversation. So any questions you guys have? Any questions? No? So okay guys, see you tomorrow with the repertory, and the day after tomorrow we will go for Alan's keynote and Organon next week. Thank you so much, guys.
Thank you, Doctor.